forms of psychotherapy. It is a combination of two therapeutic approaches, one cognitive therapy and the other one is behavioral therapy. Which methods of treatment are applied depends on the illness or problem to be treated. The basic principle behind therapy is, however, always the same, that is, what we think, how we feel, and how we behave. These are all closely connected, and all of these factors have a decisive influence on our well being. Cognitive behavioral therapy helps people learn how to identify and change the destructive or disturbing thought patterns that negatively influence their behavior and emotions. The term cognitive, it comes from the Latin word cognoscere, meaning to recognize. The point of cognitive therapy is to form a clear idea of your own thoughts, attitudes, and expectations. The goal is to reveal and change false and distrusting beliefs because it is often not only the things and situations themselves that cause problems, but the importance that we attach to them too. For example, a dangerous thought pattern might be when somebody immediately draws negative conclusions from an occurrence, generalizes them, and applies them to similar situations. In psychology, this generalized way of thinking is called overgeneralizing. Another distressing error in reasoning is catastrophizing. If something disturbing happens, people immediately draw exaggerated conclusions about the scope of the supposed disaster ahead, something which hasn't even happened yet. So, such thought patterns can sometimes develop into self fulfilling prophecies and make life very difficult for the people who are affected. Cognitive therapy helps people learn to replace these thought patterns with more realistic and less harmful thoughts. It also helps people to think more clearly and to control their own thoughts better. That was cognitive therapy. Now, behavioral therapy. This has its origin in American behaviorism. This theory assumes that human behavior is learned and can therefore be unlearned or learned anew. Behavioral therapy aims to find out whether certain behavioral patterns make your life difficult or it intensifies your problems. In the second step, you work on changing these habits, these behavioral habits. For example, people who have developed depressive thoughts often tend to withdraw and give up their hobbies. And as a result of that, they feel even more unhappy and isolated. Cognitive therapy helps to identify this mechanism and find ways to become more active again. In anxiety disorders, behavioral therapy often includes learning methods to help you calm down. For example, you can learn to reduce anxiety by consciously breathing in and out deeply so that your body and breathing can relax. When doing this, you concentrate on your breathing instead of what is bringing on your anxiety. These kind of techniques can help you to calm down instead of getting all worked up with anxiety. So, as I was saying, that cognitive behavioral therapy, therefore, focuses on changing the automatic negative thoughts that can contribute to emotional difficulties, depression, and anxiety. But these spontaneous negative thoughts has a very harmful influence on the patient's mood. And CBT treatment, it involves that changing the thinking patterns. So those involves number one, learning to recognize one's distortion in thinking, which create problems, and then reevaluate them in the light of reality. Second is gaining a better understanding of the behavior and motivation of others. Third, using problem solving skills to cope with difficult situations. And number four, learning to develop a greater sense of confidence in one's abilities. Now, there are various types of cognitive behavioral therapy. Number one is mindfulness based cognitive therapy, also known as MBCT. This form of CBT combines cognitive behavior therapy with meditation and helps cultivate a non judgmental, present oriented attitude referred to as mindfulness. MBCD CT can be very effective in dealing with problems such as anxiety, depression, and bipolar disorder. Another type is dialectical behavior therapy, also known as DBT. This uses the strategies like problem solving and finding acceptance. DBT is highly effective for treating powerful emotions and severe mental health conditions. It is also helpful for conditions such as borderline personality disorder, bipolar disorder, substance abuse, ADHD, eating disorder, and PTSD. Another type is rational emotive behavior therapy, also known as REBT. It involves identifying irrational beliefs, actively challenging these beliefs, and finally learning to recognize and change these thought patterns. Problems such as anxiety, guilt, depression, inappropriate or extreme anger, unhealthy eating, aggression, procrastination, these can be dealt with REBT. CBT is about more than CBT is about more than identifying thought patterns. It uses a wide range of strategies to help people overcome these patterns. Here are a few examples of techniques which will be helpful in understanding. One is identifying the negative thoughts. It is important to learn what thoughts, feelings, situations are contributing to maladaptive behaviors. This process can be difficult, however, especially for people who struggle with introspection. So, taking the time to identify these thoughts can lead to self discovery and provide insights that are essential to the treatment process. Next strategy is practicing new skills. In cognitive behavioral therapy, people are often taught new skills that can be used in real world situations. For example, someone with substance use disorder, they can practice new coping skills and rehearse the ways to avoid or deal with social situations that could potentially trigger a relapse. Next strategy is goal setting, which is an important step in recovery from mental illness, helping to make the changes to improve health and life. During CBT, a therapist can help build and strengthen the goal setting skills, and these involve teaching how to identify your goal or how to distinguish between short term and long term goals. This may include helping the setting the SMART goals, as we know it as SMART goals as S as specific, M as measurable, A as attainable, R as relevant, and T time based, with a focus on the process as much as the end outcome. Next strategy is problem solving. Learning the problem solving skills during CBT can help learn how to identify and solve problems that may arise from life stressor, which could be both big and small. It can also help reduce the negative impact of psychological and physical illness. So, problem solving in CBT actually often involves five steps. Number one, identify the problem. Number two, generate a list of potential solutions. Number three, evaluate the strengths and weaknesses of each potential solution. Number four, choose a solution to implement. And number five, implement the solution. Next technique is self monitoring. It is also known as diary work. Self monitoring is an important cognitive behavioral therapy technique. It involves tracking the behavior, symptoms, or experiences over time and sharing them with your therapist. Self monitoring can provide with the information the social worker or the therapist they need to provide the best treatment. For example, people with eating disorders, self monitoring can help keep track of the eating habits as well as any thoughts or feelings that went along with consuming that extra meal or extra snack. Other techniques include journaling, role playing, engaging in relaxation strategies, and using mental distractions. So, compared to analytical psychotherapy approaches, cognitive behavioral therapy is actually a short term treatment. But there is also no standard length of cognitive behavioral therapy. Some people feel much better after a few sessions, while others need treatment for several months. This depends on the kind and extent of the problem. An individual session can last about an hour. Session usually take place once a week. CBT is often offered in psychotherapy practices, hospitals, and rehabilitation clinics. It can also be offered as group therapy. So the benefits of CBT. The underlying concept, as I was saying all this while, behind CBT is that thoughts and feelings, they play a very fundamental role in behavior. For example, a person who spends a lot of time thinking about plane crashes, accidents, and other disasters, that person can avoid air travel or any sort of travel as a result. So, the goal of cognitive behavioral therapy is to teach people that while they cannot control every aspect of the world around them, they can take control of how they interpret and deal with things in their environment. So CBT is actually helpful in these ways that it can help you develop healthier thought patterns by becoming aware of the negative and often unrealistic thoughts that worsen your feelings and moods. It is an effective short-term treatment option which can be where you can see the improvements in 5 to 20 sessions. I mean, that's the range. And it is effective for a wide variety of maladaptive behaviors. It is often more affordable than some other types of therapy, and it is also effective where the therapy can also occur online or face to face. So, one of the greatest benefits of cognitive behavioral therapy is that it helps the client to develop coping skills that can be useful for both now and the future.